Welcome back to Open Med School. Today I'll be discussing plantar reflex, history, method and clinical significance of it. So, the following points will be discussed. Method of elicitation, pathways, flexor response, extensor response, alternative methods of elicitation and reinforcement. And what is meant by the withdrawal reflex, how to differentiate. It was first described by Joseph Babinski in 1896. It is a core part of neurological examinations. The method of elicitation, the better the patient will be supine with the legs extended. Use a blunt instrument like a reflex hammer or a key and consistently use the same object for eliciting the reflex. Stroke the lateral aspect, then across the metatarsal heads to the second one metatarsal head. From you just take it off. Avoid excess pressure. The duration should be 1 to 2 seconds. So the pressure should be consistent and it will take approximately 2 seconds for completion of the elicitation or reflex. Now we look at what are the afferents. Afferent is the S1 dermatome, the sural nerve, the cutaneous receptors. It is passing through the tibial nerve. The integration occurs at S1 spinal cord. The efferent for the flexor response, mainly it is the tibial nerve, and for the extensor response, it is the peroneal nerve. So, the spinal integrating segment is the S1 segment, and the cortical spinal tract is influencing this. It is a polysynaptic superficial reflex. So the normal flexor response, with the minimal stimulus there is contraction of the tensor fasciae latae followed by sartorius and adductors. The first movement that you see in the toe, the leg is starting at the little toe, it is flexed, other toes are adducted, and finally the big toe gets flexed. This may be followed by dorsiflexion of the ankle and flexion of the hip and knee. So the nerves involved are mainly the tibial nerve, but for contraction of the other muscles, femoral and obturator nerves also come into action. The abnormal response is the extensor response. Dorsiflexion of the big toe precedes all other movements, followed by fanning and extension of other toes. The muscles are extensor hallucis longus and the interossei. The nerve responsible is the peroneal nerve for the extension, mainly it is through the peroneal nerve. Other nerves for contraction of the other muscles. An extensor plantar response indicates corticospinal lesion. There are alternate methods. One is the open hem. On the shin, you apply firm pressure using your knuckles from the knee downwards. You get the same response. Gordon's reflex is the squeezing of the calf muscle. Gordon squeeze of the calf muscle. Chaddock's sign stroke below the lateral malleolus. Schaffer's is squeezing the Achilles tendon. So as the lesion extends, the reflexogenic zone also extends, and the same response will be obtained by stimulating other regions. And often, only once there is unequivocal extensor reflex or a Babinski sign, you get this sign. Alternative methods will be beneficial or useful. This reflex can also be reinforced, but there is no standard method distraction may help, you can use Gendra 6 maneuver by asking the patient to squeeze on something, turning the head to one side, to the opposite side. Sometimes it will be confused an extensor response with a withdrawal reflex. In the withdrawal reflex is a nociceptive stimulus. Entire limb is withdrawn. There is flexion of the hip, knee, and dorsiflexion of the ankle, of course. And in the plantar reflex, we are mainly looking at the movements of the toes and the speed at which it is moving. And by repeated examination, you can identify whether it is a withdrawal reflex or an extensor plantar. There is nothing called negative Babinski, so don't use that term. Either use the flexor plantar, extensor plantar. Anything other than this, you can use the equivocal plantar. For example, the big toe extends, other toes gets flexed. It's an example of an equivocal response. Extensor response occurs in human lesions like stroke, compressive lesions, subacute combined degeneration, multiple sclerosis, spinal cord injury. Flexor is a normal response. Infants may have extensor response because the myelination of the peroneal tract is required. There is something called the flexor reflexes are there in the spinal cord, and these are inhibited by the perimeral system. For that, the myelination is important. And once the cortical spinal tract is damaged, the extensor reflex comes. It is the most reliable sign of perimeral dysfunction as per Adams. So in summary, plantar reflex is a key superficial reflex. Flexor is normal, extensor is human lesions. Start from the little toe in flexor response. The extension of the big toe precedes all other movements in extensor plantar. You should know the pathways, muscles, and interpretation, and practice yourself several times so that you are proficient in eliciting the reflex. These are my references. Any doubts, you can ask in Open Med School 1346. Thank you.